Hello and welcome to my weekly video blog, and today on A.Vogel Talks Menopause we're going to be talking about how the menopause can affect your heart and tips and other things to do on how to keep your heart healthy. Now, if you like this video blog and want to be notified of all the new ones that come along, then please click the subscribe button below or at the end of this video. So how does the menopause affect the heart? There's a number of different reasons that go on here. We know that normal levels of estrogen, so this is before the perimenopause and the menopause, one of the things that estrogen does is it helps to reduce the fatty plaques that can build up in your arteries. So estrogen is a protector of the heart, if you like, in this particular way. So when your estrogen starts to fall, it can mean that there is a bigger build-up of fatty plaques on the arteries, and this can lead to a number of different symptoms. Also, falling estrogen affects the blood vessels themselves, so your arteries may get less elastic and slightly more static, and this is not good, especially for the big coronary arteries, because every time your heart beats, these big arteries need to expand to take up the pressure that is behind each heartbeat. So if your blood vessels lose their elasticity and also get furred up a lot more, then that's going to do a number of things. It's going to increase your risk of a heart attack just generally. Your levels of cholesterol can go up, and this is a really common one in the menopause. A lot of women find that their cholesterol starts to rise quite quickly as they go through the menopause. You can get palpitations. We know too that falling estrogen can affect the electrical system of the heart, and some women feel that they're either missing a heartbeat or they get two very heartbeats very close together. And I know this is a really horrible one. I've experienced this one, and it really does feel like you're having a heart attack here. Weight gain can be an issue as well, because that's going to do a number of things. If you're eating the wrong foods, it's going to raise your cholesterol, but also putting on too much weight can affect your blood pressure. And if you also have problems with the arteries expanding, so the big coronary arteries, then you can end up with blood pressure as well. And there are other risks too. There can be familiar ones. So this could be if other members of your family are predisposed to heart attack and high blood pressure and cholesterol, then you may be slightly more vulnerable as you start going through the menopause. Smoking is a huge issue here with heart attacks, and I'm sure we're all well aware of that one. And in the menopause, falling estrogen can make you more vulnerable to diabetes, and again, diabetes, there can be problems with the heart with that too. So as you can see, that there are a number of issues, health issues and diet and falling hormones that can all combine or put you in a sort of higher risk factor. The problem with this in the menopause is that very often any kind of decrease can happen very slowly. So you're not necessarily aware of any changes to your heart, to your blood pressure, or anything else that's going on, because the changes can be very subtle. And for some women, there are no symptoms at all. You might not realize that there's anything wrong until you get into that more kind of serious mode. There can be one or two symptoms that might just give the game away. So it can be things like chest pain. So this is not so much pain when you're breathing, but just if you feel that there is an ache or you're getting regular chest pain going on. You might find that you're getting shortness of breath. So you get more puffed out if you're climbing up a hill or if you're climbing up the stairs. It can also be dizziness, can be another factor. And some people find that their ankles or legs can swell up. If you get any of these symptoms, then it is really important to get these checked out by your doctor. There can be loads of other causes for these during the menopause. You know, they're independent menopause symptoms as well as being connected to the heart. But it's really important to get these things checked out as soon as you can. So how can you keep your heart healthy during the menopause? So we're looking at a number of things here. If low estrogen is causing part of the problem, then balancing and gently raising estrogen is going to be of benefit for most women. So if it's appropriate, then you could look at our menopause support. We know that this can help to just gently balance estrogen levels. Look at your diet. This is vital. So high salt, high sugar, high caffeine, high saturated fat diets, they're all possibly going to be a contributory part in health care for the heart. So look at your diet. So have healthy fats, things like your fish oils are absolutely great. If you're vegetarian or vegan, you can look at flaxseed oil. You can look at having loads of vegetables, a little bit of fruit, a good varied diet. Also look at things like your pulses and healthy grains as well, and keep your salt to a minimum. You do need salt, it is important, but you just need to stick within the recommended daily allowance, which in the UK is 6 grams. If you do like a little bit of salt, go for sea salt. The reason being is that sea salt is a more comprehensive salt. Table salt these days is highly processed, so it's a bit like white table salt is a bit like white bread. So you want to go for wholemeal bread, and the same thing is you want to go for things like sea salt and your Himalayan rock salt as well. These are salts that you can include in your daily diet. So look at exercise. This is vital for keeping your heart healthy, and there should be a little bit of stress put on the heart when you're exercising. It's this whole thing of if you're exercising and you can still talk, then you know maybe you're not quite doing enough. The problem here is, one, if you haven't done exercise for a long time and you're in the menopause, get your blood pressure and your heart health checked first before you jump into exercise. And the second thing is that obviously don't go mad with exercise. Just start off really, really slowly, just to keep things going. The other thing that can happen, we know a lot of women suffer from joint pain in the menopause and fatigue. So if you're really tired, if your joints are achy, if your get up and go has gone, then it can be very, very difficult to motivate yourself to exercise. In these situations, it's still important to keep as active as you can. So even a 15-minute walk every day, as brisk as you can manage it, will help to keep your heart healthier than if you were doing nothing but sitting all day. Manage stress. Again, stress is a huge one for the heart, and we know an awful lot of menopausal women end up with stress palpitations, which can be as frightening as your hormonal heart palpitations too. So you know, make sure that you get on top of stress. Lots of lovely stress remedies that we have, and I've done a number of blogs on how to look after yourself and to keep stress to a minimum, so it's well worth another look here. If you smoke, try and stop smoking. I know this is the difficult one, and most people do need a little bit of help, but it's certainly worth it as far as your heart health is concerned in the menopause and postmenopausal here. Limit alcohol as well. This is another known baddie for the heart. Get your blood pressure and your cholesterol checked regularly. Now, by regularly, I don't mean every week. You know, please don't go out and buy one of these blood pressure monitors, because you can end up getting obsessive about it. You can end up worrying about the slightest little variation. If you're worried at all, see your doctor. Ask how long you should be tested. For the majority of women, probably every 6 months would be absolutely fine. Changes can occur quite quickly in the menopause, so it's better doing it slightly early rather than waiting for a year or every 2 years or that round about that particular time. The other thing you can look at, if you want a nice gentle remedy for protecting and supporting heart health, then there is the herb Hawthorn. This is known to be a lovely one for the heart. It's very slow. It can also help with high and low blood pressure. So this is a nice one in that it's a balancing herb, but it can take 3 to 6 months to show benefit. So if you're needing some kind of treatment really quickly, then this is not one to go on to help in the immediate future, but this is something you can look at taking sort of long term. I hope you found this one helpful. It's an important one because not everybody realises that your heart can be affected, and the fact that there's very often few symptoms that will actually let you know there's anything going on. So just be aware of everything here, be aware of your heart health, and as I said before, if you are worried about anything, then please just go and see your doctor and get a quick checkup. I look forward to seeing you next week for another edition of A.Vogel Talks Menopause.